Wendy here, and we've treated her for temporal tendonitis bilaterally, but I think she may also have Ernest Syndrome bilaterally. And Wendy, would you be so kind, describe the kind of symptoms you have?
Really sharp pain kind of in the corner of my jaw on both sides that sometimes shoots up behind my ear and feels like I have like something either in my ear or like an ear infection or kind
Does it
of
radiate up this way too some?
It does some. I would say usually more around the back and then kind
Okay.
of curves over.
And what about your cheeks?
Kind of feels like I always have pressure and sinus
Okay.
something going on.
Anything in your eyes?
I get pressure behind my eyes at times. Yeah.
Okay. Now, we have no idea why she has this. Oftentimes, it's trauma to the mandible. But if I touch her here, and I'm not going to hurt you, I'm just going to touch you. Is that the spot right here?
Yeah.
That's the direct insertion of the stylomandibular ligament. So it's about, here's the angle of the mandible. It's about 1 centimeter above that angle right there. And I'm holding her right here. And on this side, the same right here too.
Oh yeah.
But the right is worse than the left, isn't it?
Yeah, a little bit.
Okay. So what I'm going to do is I'm going to just turn your head. I'm just going to put some betadine here. Kind of match her pretty hair there. Little betadine. And I'm going to use my, I have a mixture of celestone, soluspan, and marcaine here. I'll turn that way just a little bit. We'll find your angle. There's your angle right there. I'm going to use my burnisher, and I'm just going to sneak in right here, right behind her mandible, right where the insertion of the stylomandibular ligament is, right there. It's about 1 centimeter in width. Sometimes it's smaller, sometimes it's significantly larger. Are you okay? Is this causing pain to radiate any place? Where's it going? Just tell me. You can talk.
Oh, it's going kind of down.
Yeah,
right
and you've
here.
had pain there, haven't you? You complained. She also complained about anterior throat and even some upper chest pain, which happens, not often, but happens with Ernest Syndrome. And so I'm injecting that large ligament attachment right here. She might even get a little bit of facial nerve anesthesia because we're going between branches of the facial nerve, and maybe a little tongue anesthesia because the lingual nerve is there too. Well, that's all that is. See, it's very simple right there. And that's injection of the stylomandibular ligament insertion for Ernest Syndrome.